Hello everyone, you are all welcome to lecture number 1206 and today's topic is childhood abdominal migraine, symptoms and treatment. The word migraine, we are all familiar, means one-sided severe headache in our head. Some only not the we feel over whole area we have some pain, rather than it is shifted to only one side, that we call it, and it is very sharp, followed by nausea, sometimes vomiting, and we call it migraine. But it's not only limited to our head or headache, rather it is also experienced in stomach, belly, and that is called abdominal migraine. And this abdominal migraine is happening in adult as well as in children. But in children it is very common, especially in the age group of 6 to 10. And I am surprised to tell you that in schools from 5 to 15% children, they suffer from abdominal migraine. And once they complain such type of stomach disorder or belly pain, most of the doctors, they fail to diagnose. They start treating maybe with some antibacterial drug, anti-amoebic drug, or sometimes they think that it is gastrointestinal problem, and it has been reported that in many cases, sometimes they take 1 to 2 years to reach to proper diagnosis that this child is suffering from abdominal migraine. And if the child is in the age group of 6-7, even he will not understand the type of stomach ache or belly pain, and he will not be able to explain properly. So in that case, once you are going to doctor, first different type of tests are there: pathological, biochemical, then instrumental test means ultrasound, scanning, X-ray. After all these tests, if all are negative, you are not having any positive response, then doctors may say that it may be due to some other organ, because that abdomen area is having your kidney, gallbladder is there, appendix is there, spleen is there, small and big size intestines are there. So he may think sometimes maybe it is due to appendicitis, inflammation of appendix, or sometimes maybe some inflammation of gallbladder, or maybe some kidney problem. All these things will come, and at last they may think, provided they are enough experience to understand the meaning of abdominal migraine. And this abdominal migraine is diagnosed in only 20% cases. 80% children, they are very much delayed in proper diagnosis. And its triggering factor is The first is less sleep, nutritional problem, escaping the meal, motion sickness, sensitivity to light, noise pollution, lot of noise. So these are all triggering factors, and the symptom is that nausea, feeling of sensation of vomiting, dizziness, weakness, and losing appetite. So these are all combined factors, and the best treatment for abdominal migraine is the anti-inflammatory, anti-histamine drugs. And there are a lot of papers nowadays published, because before, for migraine, people were saying that if you have that attack of migraine, it may last for 70 hours to 2 days time, and then you cool down and lie down in some dark places for few hours, and they were having impression that there is no any specific medicine, but here we can treat the symptoms. And one thing, if in children, because of chronic condition, if he is going and vomiting several times, immediately you give intravenous glucose saline drip. Otherwise, he will be subjected to chronic dehydration. And also, because of such type of nausea and dehydration, the electrolyte of the body of the child is disturbed, and that is serious problem. So in that condition, you identify it and start giving some electrolyte, or if it is severe, don't take risk, give saline drip, that is called glucose saline intravenous drip, so that at least his energy level and fluid level in the body is maintained. And this abdominal migraine is actually related to family history, is genetic factor. Those parents who are having this tendency of migraine, the children may get either in adulthood or during childhood. Also, lifestyle plays important role. Lifestyle means if you are under stress, strain, hidden tension, and sensitivity towards light, towards motion sickness, and also junk food where sodium glutamate is there, and that also trigger the abdominal migraine. And also hydration is also one of the factor. You should keep your children hydrated, let them have good sleep, and watch, maintain diary, that in what circumstances, what time your child is getting that type of migraine attack, I call it, that is abdominal migraine. Maybe once in a year, once in a month, or twice in a month, or frequently every week, timing and date, and then keep on observing his or her lifestyle, food pattern. Lifestyle means sleep and going to school, and in school whether he or she is having under some tremendous stress by teacher, by bullying of the colleague. So these are all many factors for childhood abdominal migraine. And the best medicine, the treatment is non-steroidal, anti-inflammatory and antihistamine. What if I say histamine? Histamine is a type of compound which is produced in the stomach, intestine, in belly, and that one is creating the problem, and because of that production of histamine, your stomach will be having some irritation, itching and inflammation. So you have to give some anti-inflammatory drug, and you consult your doctor. And if I say doctor, means not the doctor who is distributing malaria, anti-malarial drug sitting side by window. It should be experienced consultant so that he can understand and properly diagnose the abdominal migraine. And the second drug is anti-inflammatory, because there will be some inflammation in the intestine, some injury may be there. So in that case, if anti-inflammatory drug is given, it can take care. So these two are the main drugs, non-steroidal, antihistamine and anti-inflammatory drugs are given. And some latest research publications, they have indicated very clearly that this migraine condition, whether it is abdominal or in head, is because of mainly sleeplessness and stress, either in adult or in children. And stress, if I say stress, there can be variety of reasons. Inside family house, he can be stressed. Inside school, he can be stressed. The teacher may be bullying or sometimes putting some stress. Maybe some in class he is not performing well. He is humiliated, bullied by the friends or colleagues in the school, sensitive to the light, sensitive to the food and junk food, sodium glutamate. These are all very, very important triggering factor so that the children are subjected to abdominal migraine. So the latest publications are indicating that once the children or even adult, they have mental tension, stress, and they are not sleeping well, not taking food at the proper time, not doing exercise, so their hormones are disturbed. The production of especially two compounds. One is called serotonin, neurochemical, and the second one is called histamine. So this serotonin and histamine, they are mainly compounds or chemicals responsible for triggering the migraine. Serotonin is known as a neurochemical, neurotransmitter, and it is known as to keep you happy, in happy mood. It will suppress nausea, it will suppress your emotion, over emotion. It is also, overreaction and over emotion, that will be controlled, and your antihistamine drug will control the production of histamine. So these are all measures we have to take care. So here I am showing very clear picture or image of abdominal area of a child, and under red circle, that is, I call it in English, a button of belly, and in our Indian language they call nabhi or dhodi, and in English we call it button of belly. That is the area under a red circle where if a child gets some stomach ache or some pain or some irritation, it means there is chance of abdominal migraine. So it is very clear image of anatomy of your abdomen, and where your small intestine, large intestine, your stomach, your kidney area, your appendix, spleen, all are present in that area, and that's why instrumentation is very necessary, like ultrasound, MRI, X-ray, all this, so that to understand whether other organs are not involved. Only when it is all negative, then doctor can think of abdominal migraine. You might have noticed to one side of the head below your eye and above the eyebrow, there is lot of irritation and pain. So that is called one-sided migraine. It happens in head, and this very clear picture, that is in adults it happens, also in child also, and the similar type of thing if it happens in abdomen, that is called abdominal migraine. You can see here the child is sitting under the arm or lap of the mother, and he is totally confused. He cannot explain the type of pain he is getting, or stomach ache, that belly around the button of the belly, and only then mother will put the hand and will ask several questions. Then slowly he will give some indications. He may not explain. So with that indication, it is mother and doctor, both they must coordinate very thoroughly. Only then they will reach to the conclusion that it is abdominal migraine. And I have already told you that in 80% cases, it takes 1 to 2 years to reach to diagnosis that it is abdominal childhood migraine. So here I have given some summary of research publications, latest ones, and they are very interesting. So number 1, abdominal migraine is difficult to diagnose in children. Diagnose. Let me complete it. Diagnose in children, and 70 to 80%, in 70 to 80% cases, they fail to diagnose, and it takes 1 to 2 years. Children are diagnosed after 1 or 2 years time. Number 2, triggering factors. The triggering factors are, first factor, that is stress, strain, mental tension, poor sleep, anxiety, over emotion, that means they become emotional, missing meal, taking lot of chocolate, monosodium glutamate, that is MSG, in junk food. Once they are taking lot of junk food, that these are all in publication. It is mentioned that these factors are there. Otherwise, some 20-30 years ago, they said that there is no any specific medicine. You can only manage. You should be good manager. But now it is identified that some neurochemicals, some histamine, serotonin compounds are responsible of abdominal migraine in children, and also some nitrates are present. This is very much disturbing, that these nitrates, they are found in the foods which are highly processed, because in modern age, we go for processing, we go for crystallization, we don't like natural or crude or whole grain. So once you are moving towards more refining and highly processed food, definitely you are moving towards the abdominal migraine in your child. And then highly processed food. Number 3, symptoms. It will hurt in the center of your child's body, and that is around belly button, your navi in Indian language, and feeling of quasi or throw up, be pale or flushed, feel drowsy, lose appetite, having dark shadow under your eye. These are all symptoms. The treatment, there are a lot of new drugs available. They are mostly anti-inflammatory, antihistamine, and they are non-steroidal. Their different names are there. Your doctor must be knowing. If he is not knowing, you can discuss and you can mention that these are drugs. Globally, they are used. And I have already told you in the beginning that most of the drugs are of three categories. One is antihistamine, and then second one is anti-inflammatory, and third one is that is to control nausea and to control that is your motion. So that is anti-nausea drugs. So these are the drugs. To know how frequently, first, if you are going for treatment, you should maintain the history, how frequently it is getting, and non-steroidal anti-inflammatory drugs should be given, also anti-nausea and antihistamine drugs. Oral analgesics are also administered, that is pain reliever, and those are like brufen or tryptophans or Tylenol, cyproheptadine, that is cyproheptadine, that is your actually helping belly trouble. That is very specific drug that helps lot of problem of belly. That is your cyproheptadine, and then propranolol, that is beta blockers, and valproic acid. Valproic acid is sold in the market in the name of Dipacol, and serotonin. Serotonin you discuss with your doctor to suppress nausea, to elevate your very good mood. If you are in tension, just 2.5 mg is enough. So these are all medications. So with this I will stop, and let me tell you, I have seen the parents and I have seen their pain when their child is suffering from abdominal migraine. It's painful to parents equally. So please, once such situation comes, cultivate patience and go for proper diagnosis and proper treatment in the hands of experienced, qualified consultant, those who are dealing with your intestinal problem, they can handle. So once again, thank you very much for watching the lecture.